Pathology is a very important medical specialty, and it assists and enables the prevention, diagnosis and treatment of illnesses. Effectively, it's a service to doctors, and it's to assist the doctors in diagnosing and treating their patients. About 1 in every 5 consultations with a general practitioner result in a pathology episode, and 1 in every 2 consultations with a specialist result in a pathology episode. 70% of clinical decisions made by doctors rely on pathology, and 100% of cancer diagnosis relies on pathology. The other important part is 60% of Australians will have at least one pathology test in a year, and those with chronic diseases have a lot more. Well, a very important role, clearly. The early diagnosis of illnesses enables a more cost-effective treatment, and it improves patient outcomes. Clearly, the whole notion of personalized medicine and precision medicine, as it's coined these days, is underpinned by pathology, because pathology moves away from the concept of trial and error. We don't have to guess. We have what treatment plans. With good pathology diagnosis, you can actually get more precise outcomes for patients. But not just the diagnosis. Pathology is playing a very important role now in the prevention of illnesses. Those that may be susceptible because of family history to certain disease types, or maybe based on your age. If you have proper screening and regular screening, pathology plays a very important role in making sure those illnesses that might later need to be treated don't arise or are delayed in their onset. That's a very interesting question. In terms of operational models, how pathology laboratories operate is largely similar around the world, and that's actually dictated by the large multinational companies that provide the equipment and the reagents that are used for testing. So large companies like Siemens, Roche, Abbott Diagnostics, they spend billions of dollars on the technology, and that's deployed by laboratories pretty much right around the world. Within a laboratory, the way the laboratories are structured, pre-analytical, analytical and post-analytical, are largely the same. But pathology practices actually differ based on the environments in which they operate. In Australia, for example, the government is largely funding the pathology purse, and it does so on a fee-for-service basis. In New Zealand, it is government funding, however, it's under a cap funding environment. You have countries in Asia where the governments actually aren't providing the funding. That funding is actually coming directly from the users of the service, patients. So those models are actually quite different. Also, what's different is in some countries the collection of specimens, blood or urine, is done by the pathology practice, such as in Australia or New Zealand. We have collection centers. In other countries, particularly in Asia, we don't have the concept of collection centers. These samples are actually collected by the doctors. So we've had sort of incremental growth over the years, largely because we've got a very strong operational team. We've got a very experienced management team, and we deliver a world-class service, and we do it very cost effectively for the funders, which are the district health boards in New Zealand. And not just that, not just deliver cost-effective services when we win contracts, but we continuously deliver efficiency dividends back to district health boards through improvements in the service, and also through funding improvements. So pathology is an ever-changing landscape. I've been in this industry now 28 years, and it looks vastly different today to what it used to look like in the days when I started, which had very little automation, and we still use dot matrix printers to print our results. Things have changed. And the next 10 years is exciting because there's going to be a lot of changes in the market. So firstly, from a consumer point of view, from a patient point of view, I think the role of the consumer is actually increasing, and I think patients are becoming more informed of their own health and less reliant on just what the doctor says. So they want to find out about their own health, and I think that's driving some of the change that we're going to see in our industry as well. The market itself, a lot of the pathology is done in the community space, and I think that's going to continue. In some markets around the world, hospital pathology dominates the volume of pathology services provided, but I think even that's going to change. There's a need for increased wellness and for lifestyle reasons, people wanting to know about their own health and actually monitoring their own health. That's going to drive some of the changes. In terms of funding, the old established models of fee-for-service, where you pay for each test or a bundle of tests on their own, is going to change. I think value-based funding is going to replace fee-for-service funding. In terms of the operational models, I think there's a need for pathology to be provided closer to the patients, and that's going to happen, and it's going to be done in sort of more infrastructure-light models. The traditional models of heavy-duty collection centers and having large logistics businesses is probably going to change towards patient convenience. I think that's going to drive a lot of the changes going forward. In terms of technology, artificial intelligence is the rage these days. Everyone's talking about it. Now in pathology, we've deployed artificial intelligence over the years. That's how we've got efficiency dividends. That's how we've become smarter. But it's going to play a far bigger role. And some of the applications of AI are going to be in things like precision medicine and computational pathology, where we're going to automate some of the things that the human brain's been doing. That's going to change into a more automated processes driven by AI. I think there's going to be a bigger role for the private sector in the public space. PPPs are happening around the world in various forms. I think that's going to be more prevalent in pathology as well. I think the pathology model where you integrate private and public is going to play a bigger part as years go on. And lastly, I think from an industry structure point of view, this industry has constantly consolidated because efficiencies for larger scale businesses are quite evident to see. And I think as time goes on, the smaller providers are going to get consolidated into larger units, and effectively consolidation is going to keep happening.